Good morning, everyone. I guess we can start the meeting now. We have an ample some people joining us already. Good morning, everyone. On behalf of the head of Pharmacy Department, University of Ilorin Teaching Hospital, Pharmacist Charles Wakili, and the head of unit, Drug Information, Pharmacist IK Bello, I welcome you all to today's clinical meeting to commemorate the World Cancer Day. I recognize and welcome fellows of Pharmaceutical Society of Nigeria, fellows of West African Postgraduate College of Pharmacists, the chairman, PSN Kwara State Pharmacist Adejuwon Otelaja, the chairman, Association of Hospital and Administrative Pharmacists of Nigeria, Kwara State, Pharmacist Joseph Ole, pharmacist, home and abroad, head of unit, elders, colleagues, ladies and gentlemen. Every 4th of February is the World Cancer Day. And the theme for this year is Close the Gap. Cancer is the second leading cause of death worldwide, and about 10 million people die yearly. It has huge economic impact on the patients, their families, and the nation. And sometimes the patients are really traumatized. We want it to be an interactive session as much as possible so that we learn from each other, share knowledge. So kindly raise your hand after the presentation or use the chat box to type in your comments, your questions, or share your experience with the cancer patient, either as a survivor or your experience with the cancer patient, and how you intend to close the care gap in your facility. All right, our presenter is ready. She is pharmacist Lydia Modupe Olariwaju. She is the Deputy Director of Pharmaceutical Services, University of Ilorin Teaching Hospital, and the Head of Unit Oncology Pharmacy. She is passionate about cancer care, and she has had training, attended workshops and seminars both locally and internationally. She will be sharing and discussing the sub-theme, Pharmacists Close the Care Gap in Cancer Care. After her presentation, there will be a short video to mark the World Cancer Day. It's a pleasure to have you, ma. Over to you. Yes, ma'am. Pharmacist Olariwaju, you can start sharing your slide. Pharmacist Olariwaju, are you there?
Hello.
Hello, ma'am. Yes,
Okay.
ma'am. Yes, ma'am. Over to you.
Okay. Good morning, everyone.
Yes, ma'am.
Good morning, everyone. I'm pharmacist Lydia Modupe Olariwaju. I am a Deputy Director of Pharmaceutical Services at University of Ilorin Teaching Hospital. I am the Head of Oncology Pharmacy. I will be presenting on Pharmacists Close the Care Gap in Cancer Care. Every 4th of February has been tagged the World Cancer Day. And what is the aim? The aim is to create awareness. The aim is to make people to encourage prevention, detection, and treatment. And this is an international initiative. It is led by Union for International Cancer Control. The theme is always given for 3 years. Year 2022 is beginning a new theme, which is Close the Care Gap. These are the outlines of my presentation. What is cancer? Cancer is a broad group of various diseases, all involving unregulated cell growth. In cancer, cells divide and grow uncontrollably, forming tumors, and this can infect nearby part of the body. Cancer can start almost anywhere in the human body. The cancer may also spread to more distant parts of the body through the lymphatic system or bloodstream. This is called metastasis. We want to see the difference between normal cell and cancer cell. For normal cells, cell division is regulated. Normal cells respond to external growth and anti-growth signals. Normal cell, there is apoptosis, that is programmed cell death. For normal cell, it develops into a very distinct cell type with specific function, and there is no occurrence of tissue infection. Let us look at cancer cell. The cell divides uncontrollably. It does not respond appropriately to signals that control normal cell behavior. There is absence of apoptosis. The cell do not develop into distinct tissue type, and there is no specific function. There is tissue infection and metastasis also occur. We want to see type of growth. This is just to tell us that it is not all growth on the body that are cancerous. There is benign tumor. This type of tumor is not cancerous. It grows slowly and does not spread to other parts of the body. It is made up of cells similar to normal cells. Malignant tumor. This is the cancer itself. These tumors grow faster and they have ability to destroy nearby tissues. They can break off from the primary tumor and spread to other parts of the body. There can also be precancerous tumor. This involves abnormal cells. It may develop to cancer and it may not. And that is why when there is precancerous cell, they ask the patient to come maybe in 6 months' time, in 1 year's time, so that they're able to know what is happening to the patient. Type of cancer. Cancer can be classified according to the types of cells they start from. There is carcinoma. This is the cancer that starts from the tissue that line or cover internal organs. That is the epithelial cells, e.g. breast cancer, prostate cancer, colon cancer. There's also sarcoma. It is the cancer that starts from the cells of the bone, the cartilage, fat, muscles, blood vessels, or other connective or supportive tissue, like osteosarcoma, the cancer of the bone. There's also leukemia. This is the cancer that starts from the white blood cell or their precursors, such as the bone marrow cells. Then we have lymphoma. This is the cancer that starts from cells of the immune system that affects lymphatic system. We have myeloma. It starts from plasma cells and can affect cells that produce antibody. It can also spread through lymphatic system. There's also central nervous system cancer. This one starts from the brain or the spinal cord. That tells us that cancer can start from anywhere and it can occur in any part of the body. This ribbon, I know we have been seeing it, people wearing it, is just to show support for people that are affected with cancer. So people wear it to show support, and people wear it also to show, to create awareness of cancer. So there are different colors. There are some that the color is the same. The color is the same, like bladder cancer and sarcoma cancer. So it doesn't matter. People wear it. And there are other ribbon type too that people wear just to show support for people that have cancer. Risk factors. I want to say that there is no one that knows the causes of cancer, but there are predisposing factors that have been identified. We have the modifiable ones, the one that we have control over. We have the one that we have control over, and we have the one that we do not have control over. So the one that we have control over is the modifiable risk factor, which is when people are obese, when there is overweight, when the diet and nutrition is not really balanced, when there is no physical activities, when somebody is smoking. Somebody said that 70 types of carcinogenic substances. When there is too much alcohol drinking, when somebody is exposed to ionizing radiation, when somebody is working in an hazardous place, like a worker in chemical dyes industry, or working in an asbestos producing industry. When there is infection like HPV, human papilloma virus for cervical cancer, when there is hepatitis B and C, all these are predisposing factors that can cause cancer, and they are modifiable risk factors.
Hello, also we've lost you. Are you still there?
Yes, I'm there. I'm there.
We can't hear you.
Oh.
Okay.
I'm there.
Hello, ma'am.
Hello.
Okay, you're on now.
Hello.
You're on now, ma'am.
I'm on. Okay. Hello.
Hello, ma'am. You can continue. You can hear you now.
Okay, but are you seeing my screen? Are you seeing my screen?
You can continue.
Okay. Are you seeing my screen? Okay. Bodies of cancer. Bodies of cancer. Cancer is among the leading causes of death globally. In 2018, 18.1 million new cases and 9.5 million cancer-related deaths were recorded. Low and middle income countries, including Nigeria, bear most of the cancer burden. In 2020, of 10 million cancer-related deaths worldwide, 70% are in low and middle income countries. Don't forget, Nigeria is giant of Africa. So we bear more of these deaths. According to World Health Organization, over 41,000 people die from cancer-related causes in Nigeria, with about 116,000 new cases in 2018. Prostate cancer, liver cancer, non-Hodgkin lymphoma, colorectal cancer, pancreatic cancer are the 5 common cancers that can be found in Nigerian men, while breast, cervical cancer, liver cancer, colorectal cancer, and non-Hodgkin lymphoma are the 5 common cancers that can be found in women in Nigeria. These are the treatment options for cancer. These treatment options depends on the choice of which of the treatment depends on the type of cancer, the status of the patient, the functionality of the hunger of the patient. There can be 2 or 3 or 4 combined together to treat a particular patient. Here at University of Ilorin Teaching Hospital, we have hormone therapy, surgery, chemotherapy, we have immunotherapy. We are still moving on. We believe very soon we will have radiotherapy for our patients. The clarion call. This morning, we are saying pharmacists close the care gap in cancer care by playing our role. What we are saying is that let us save lives by improving early diagnosis. And how can we do that? By creating awareness about risk factors, awareness about cancer itself. There is the need for us to create awareness wherever we are, in our organization, churches, even these days, personally, I will say, even within family fold, there is the need for us as health workers, as pharmacists, to talk about cancer. We have a shop, we have pharmacy outlets, we can put, a poster, something that talks about cancer, so that we prompt people to want to ask questions, about cancer, or discuss what they have under their garments. We are to also create awareness about treatment options. There are a lot of things that are going on the social media about caring for cancer patients. And that has led many people, not to access care on time. And it has increased, the death rate. So there is the need for us as pharmacists to let people know all the treatment options that are available for the care of cancer. There is also need to educate all pharmacy staff on cancer, so that as people approach us, this is what is happening to me, we can always direct them appropriately. And I want to say again concerning pharmacy outlet outside, we can as well educate our staffs on cancer, so that when people come, to access their therapy, the attitude of the staff we encourage the patient to want to come again. I've heard of a patient that says that she does not like to access her drugs outside at community pharmacy. Why? Whenever she shows her prescription, the way the staff look at her is like, oh, you are dying the next day. And for that, she doesn't want it. So please let us encourage our staff on the need to show empathy to patients, and on the need to show a good attitude to patients, either cancer patients or non-cancer patients, as they come to access their chemotherapy. I also want to say that it is our duty as health workers to encourage survivors to come out to encourage others. When people that have cancer, when they see people that have gone through it, they are encouraged, and they want to go through all that it takes to finish their therapy, so that they too can become a survivor. I also want to say that it is our responsibility, first responsibility, to increase availability of drugs, especially in the hospital. We know that non-availability of drugs and unaffordability of drugs has been a major factor that contributed to late presentation of patients in the hospital, and that has increased the mortality of this disease. So I want to say that there is the need for us to increase availability of drugs in the hospital. Here at University of Ilorin Teaching Hospital, we now have oncology pharmacy separate. So with that, it enables the pharmacists in charge and pharmacists, all the pharmacists that are here, to just, they have little at hand. They have a little number of drugs at hand to work on, to talk about, to look for how they can get it. So it's easier for them to, to make the drug available in the hospital. And again, there is the need to increase affordability of this drug. Thank God for the Nigeria Cancer Access Partnership Program. That is the collaboration of the Federal Ministry of Health, the Clinton Health Initiative, and the American Cancer Society. They had a collaboration so that they can bring in drugs at affordable price. So about 12 hospitals now are operating, they are operating this program. And in reality, the price of the drugs to the hospital are a bit reduced compared to the normal one that we buy, that the patient buy outside. So this has really, made more patients to come to the hospital to access their drug, especially those that have breast cancer. Though not all the drugs on their list are presently available, but the ones that are available, the patients are able to access it. Pharmacists should also be member of the multidisciplinary cancer care team. Here at the University of Ilorin Teaching Hospital, the pharmacist is part of the multidisciplinary breast cancer team. We are also to educate patients. We educate patients on the disease. We educate patients on the therapy. When it will finish, we allow them to ask questions. All that they have known and heard about the care of cancer, they want to confirm, it is true? Is it right? So it is our responsibility as pharmacists to educate them. Though every one of us may not have access to knowledge about cancer care, but at the same time, we may not be an oncology pharmacist. There is the need for us to know little things that people can ask that can help them, to go in their journey of care for cancer. It is also important that we counsel patients on the management of side effects of chemotherapy. Every one of us knows that chemotherapy has its own side effects and that needs to be managed very well. When at University of Ilorin Teaching Hospital, when patients come, especially the first timer, we let them know what they will meet. We let them know the side effects of the drugs, the alopecia, the vomiting, the diarrhea, and things like that. We let them know it. The high in temperature, in case there is high in temperature, what to do. We let them know and they ask questions. We also counsel them that in case if you have alopecia, you may not really like it. You can have a week before you start your chemotherapy. So we give a pre-counseling. Then during the time they are taking their drug too, there's always a follow-up. So this is what we should do to really fill the care gap of the care of cancer patients. Then we are to carry out medication therapy management. We know that some of these patients, there are some of them that have other comorbidity. They have hypertension, they have HIV, so they are diabetic. So there is the need to marry all the drugs together, to review it and allow them to take a personal decision about their drug. We, as pharmacists, we are to promote chemotherapy safety. chemotherapy on its own can have effect even on the normal cell. Last year, October, during the International Cancer Week at Abuja, there is this chemosave policy that was launched. It is all about centralization of the constitution of chemotherapy and centralization of administration of chemotherapy. The administration of chemotherapy by the bedside is being discouraged so that we will prevent pollution of our environment with chemotherapy, because we know that it can affect others that are not even having the disease cancer. It is also the responsibility of pharmacists to prepare oral morphine, because at a stage in the life of this patient, they always have pain. Thank God here at University of Ilorin Teaching Hospital, we have the palliative care, and we have one of our pharmacists, a fellow of the Pharmaceutical Society of Nigeria, Pharmacist Alege, who is a member of that team, and they see to making sure that morphine is available, morphine powder is available in the hospital. We also have a pharmacist that does the compounding of this morphine for the patient. So in conclusion, I want to say that people who need care, who need cancer care, they meet with obstacles at every turn. And we are saying that as pharmacists, there is the need for us to raise awareness and stop the unequal care given to those suffering from cancer across the world. Inequality in cancer care can cost life. So every one of us, let us get involved any way we can, because together we can close the care gap in cancer care. Thank you. These are my references.
Thank you so much, ma'am. Kindly stop sharing your slide. That was very educative and incisive. Thank you very much, ma'am. And the take home is that we should save life by creating awareness of the risk factor, the disease itself, the side effects, and then the treatment options. And then we should close the care gap by encouraging survivors to come out and encourage others to go through the treatment. Thank you, ma'am. We appreciate you. I want to recognize pharmacist Ajia Fatima Mustafa for joining us. Thank you, ma'am, for joining. And Dr. Felicia Williams, we appreciate you, ma'am. Thank you. We'll quickly share the video now. After the video presentation, we'll take our comments, our questions, and then our contribution. We want it to be interactive. We are trying to close the care gap. So your experience will be highly appreciated. Thank you.
And old, rich and poor, black, white, and male, female, trans, and other, right and the left, east and west, followers, leaders, believers, and non, everyone. Far more unites us than divides us. So let's all agree, the people and the powers that be, to make the world aware we need to close the gap in cancer care.
That is a short video to commemorate the World Cancer Day. So it's now time for questions, comments, and contribution. Yes, ma'am. Dr. Mrs. Felicia Williams, you have the floor, ma'am. How do you unmute yourself, ma'am?
Hello.
Yes,
Good
ma'am,
morning,
can hear
all.
you.
We appreciate the beautiful presentation by Pharmacist Dr. Modupe Olariwaju. I know she's doing a lot at her workstation. I want her to share the experience she has with regards to her implementing pharmaceutical care on the quality of life of these patients that is encouraging her to continue. Thank you.
Yes, ma'am, Mr. Olariwaju, did you hear a question?
Yes.
Okay, kindly respond, ma'am.
Well, I want to say, I think it's just all about passion for the work. In 2012, I was posted from main store to inpatients. That time, the cancer drug is issued like other drugs to all the units. And prior to that time, I've done one workshop with Roche company on cancer, on chemotherapy. So with that knowledge on getting to inpatients, I just discussed with one of my senior colleagues, and she agreed, and we went to the then HOD that can we gather all cancer drugs together in a place so that as time goes on, we can have it as a unit. And the HOD agreed. So that's how the journey started. Then that's my colleagues also encouraged me to go for Farmer Bridge, and which I did, though the money there was no sponsor from the hospital. So with that knowledge, I am able to learn one or little things, and with the workshop we are having now here and there, and with the association that I belong to, Oncology Pharmacy Practitioner Association of Nigeria. So with that, I am able to gain knowledge, and as patients comes, when you see these patients, you cannot but just to, to help them. You cannot just to be calm with them. There's sometimes you spend more than 30 minutes with a particular patient, asking them questions. There have been a patient that refused to talk at the first visit, but by the time she was coming again, and you keep on counseling, it's just all about counseling and being patient with them.
We lost you there. Hello, ma'am. That is network issue. We recognize all radiologists in our midst, and Mr. Pratt Jaffet, I guess I got it right. You are welcome, sir. Our presenter is having issues. So kindly use the chat box for your questions, your comments, or raise your hand, please. We want it to be interactive. Any other question or comments? Dr. Mrs. William, we are still expecting her to join us. She has network issues. I guess she's not part of your question. Answer some of your questions. Comment, contribution, or you can share your experience in your facility or even with a cancer patient. A bit to raise awareness about the disease and the treatment options.
Hello?
Yes, ma'am.
Okay, sorry.
Welcome back. Welcome back, Mai. You can continue.
So I have to subscribe to Lexicon. So with that, I'm able to carry out, the pharmaceutical care. I have an app where I can look at information to give to patients. And on Lexicon, you even have patient education and all sorts. So with that, I am able to carry out the pharmaceutical care for the patients.
Thank you so much, Ma. Any other contribution or question?
Hello.
Yes, ma'am.
The other aspect of the question is, how has this impacted positively on the quality of care of the patients that keep her going?
Hello?
Yes, ma'am.
I believe it has impacted on the quality of care for the patient, because I've seen patients, like the patient there was this patient that came and followed by two women. They tied their wrapper as if they were going to war, and the patient refused to talk. I was talking to the patient. The only answer she was able to give me, in the process of counseling, was the tears that were rolling down her cheek. And so later I called, I keep on following up. She started coming for chemotherapy. Then later she finished the chemotherapy, the mastectomy, everything. One day, I just saw the woman. She just embraced me from the back. I was in the office. Then we were at inpatient pharmacy. She just grabbed me, and I was looking. Really, I could not even, recognize her. But when she started talking, you remember this, so, and I know it has really impacted on the life of the patient. And there was also a patient that called. The temperature was getting high, and they were at Ekiti. So it was even of recent. So the husband called, oh, this is what is happening to my patient. And I said, okay, you can, though it is not for me to prescribe, but with what we have at hand, I know that with that high temperature, there is neutropenia, the neutrophil is low, and there is tendency for infection. So I just told the patient, oh yeah, quickly go and buy Augmentin and make sure it is the branded one that you buy. And tomorrow morning, bring the patient to the hospital. So the patient bought the Augmentin, started the Augmentin, and the following morning she came to the hospital. So they met me, then I called the doctor that this is what is happening, and they started from there, admitted her, and she just stayed for the hospital just like 3 days. Assuming there was no intervention like that, that may bring about sepsis. It can even bring about a serious problem that can lead to the death of the patient. And with that little intervention, the life of the patient, was saved, and at the same time, the stay in the hospital, the number of days that she stayed in the hospital was reduced. So with that, I know that with what we are doing is impacting the life of the patient.
Yes, is impacting the life of the patient positively. Thank you so much, ma'am. Any other question or contribution? Question or contribution? In the absence of contribution, comments, we'd like to say thank you all for joining.
Hello?
Yes, ma'am. We'd like to.
Hello?
Hello, ma'am. Yes, ma'am.
Can you hear me?
Yes, ma'am.
Can you hear me?
Yes, we can hear you.
Yes, we can hear you.
Hear me?
Yes.
Good. We appreciate the good work you are doing. The other thing that comes to my mind is the affordability. Despite the NCAM program, are the drugs so affordable now that anybody can, just that is a cancer patient can easily access those medications vis-a-vis our cost of living, poverty level in Nigeria?
Well, that affordability, I will say it all depends on the individual. You know, initially, let me say that before now, if you want to cost a drug for a breast CA patient, the patient can be spending like 79,000 for the type of drug we have. But now, at least something like 24,000 is out of it. So, so the word affordability is relative. It all depends on the individual. But with the Nigeria Cancer Access Partnership program, I think it has increased the availability of drugs in the hospital, because naturally, nobody will want to buy a cancer drug for the short expiration date, for the cost, because it's very, very expensive. Here at University of Ilorin Teaching Hospital, thank God for the procurement pharmacist Adiogun, that had this initiative of just removing, the purchase of a cancer drug from the normal purchase. So he always presents it as a separate purchase, to the management. So they don't add it to the purchase, our quarterly purchase. So it's a relative, but I know even with that, you still see patient that comes and they cannot afford, they have to go. The care of cancer, it involves the whole family, everybody. So they will go, they'll be looking for money and things like that. So for Nigeria patients, I will say it's still high. And again, the draw for NCAP is not, the NHIS patient do not have access to that particular drug, because the patient has to pay directly into an account. It's not there is an account that be created for each hospital. So they pay directly to that account. So the NHIS patients, they don't have access to that program. But the last meeting we went for at Abuja, they were thinking of how they will incorporate NHIS to that program. Because now, the NHIS, initially, NHIS, maybe around 2016, they started having oncology drugs on their list. Now they have increased the number of drugs on that NHIS list. The last page of it is the added list of oncology drugs. You have even the monoclonal antibodies there. Yes, the drugs can be on NHIS list, but are they available in the hospital? So that is the question. And to have the drug in the hospital too, one has to be careful, because you may have monoclonal antibodies, you buy it for NHIS, you may not even have one NHIS accessing that drug until the drug just expires. So the good thing will be if the Federal Ministry of Health can incorporate NHIS into the present Nigeria Cancer Access Partnership program. It will really help the populace, the public, and it will help the cancer patients. Thank you.
Thank you so much, Ma. We hope this message will get to the policymakers, and that will really impact on a lot of patients and help in their care. That will be one way of closing the care gap in cancer care. Thank you so much, Ma, for the presentation. We appreciate you. There is a question here from Pharmacists, I guess, I'm not sure, from Pat Jaffet. Say, ma'am, what may be the treatment cost for a stage 2 cervical cancer patient? Are you with me, ma'am?
What is the cost?
Yes, treatment cost. Not cost as in monetary term, cost as in duration for a stage 2 cervical cancer patient.
Okay. I want to say that as I've said the other time when I was discussing about the treatment option, it all depends on the patient. But I know most of the cycle, it depends on the stage at which the patient appear. It depends on how the patient is responding. It also depends on the functionality of the organ in the body. It depends on the performance status of the patient. So there are a lot of things, you know, that attach to the cause. But most of the time, for all the cancer, fixed courses of chemotherapy are mostly given to cancer patients. But it also depends on the regimen. So there are some regimen that the way they give it, I remember a patient with, they just give it for 3 courses. They just give 3 courses and that's all. But that also depends on the time the patient appear. And it depends on the side effects also that the chemotherapy is given to the patient. It also depends on the aim of the therapy. Is it for the goal of treatment? Is it for cure or just to improve the quality of life of the patient? So one may not actually say that this is it, but most of the time, as the patient, there have been patients that receive up to 8 courses of 8 cycles of chemotherapy. It all depends on how well the patient is responding to chemotherapy.
Thank you so much, Ma. We also recognize fellow Alege of UITH. We appreciate you for joining us. The question, okay, he added that she's been told to source for 650K, that's 650,000 in National Hospital. I guess the patient in stage 2 cervical cancer, the patient on stage 2 cervical cancer was told to source for 650,000.
Okay.
At National Hospital. I don't know what he wants to get out of that, but does that make any sense to you, ma'am?
Yes, it all depends. Maybe like that patient now, after chemotherapy at times, they can decide to follow up with radiotherapy. They can decide to do removal of the womb, for cervical cancer. So at times, they ask them to look for money. What they do at times, they ask them to look for a particular money so that it will not be that they are starting and they are stopping. So it is better not to even start at all than to start and now they stop along the way. All that they have spent will not be a waste. When they come at a later time, it will not be that they are giving salvage therapy and they are starting all over again. So at times they ask them to look for a particular amount of money so that when that money is there, they know they have something they can always, they can always spend when there is need for any treatment. When there is need for any treatment.
Thank you so much. Thank you. Pharmacist Japheth is very appreciative for your answer to the question. We would like to recognize Dr. Faith, Dr. Faremi, and Dr. Atoa of University of Ilorin Pharmacy Department, Pharmacist Olumo, and Pharmacist Ukeri Darita. Thank you so much for joining. And Pharmacist Adeogun, thank you for joining us. He's in the cloud. Thank you very much. We appreciate you all for joining us today. Dr. Atoa is suggesting here, say, as a suggestion, man, kindly be encouraged to document your pharmaceutical interventions to enhance policy making and training purposes.
Thank you. Thank you.
Did you hear that?
Yes, thank you. I've seen it in the chat box.
All right, thank you so much.
Thank you.
We would like to end this presentation. It's been very interactive. I can see Dr. Williams raising her hand. Yes. All right, 1 minute.
A brief one, very brief. Now, you are doing so much, doing great work
in the life of the patient and also impacting positively on the profession. What effort is being put in by the management in this time pharmacy to ensure continuity of your work, sustainability, that is encouraging specialization in oncology pharmacy?
Well, to answer that question, I know there are, before we are here, we have other pharmacists that are being involved in the care of cancer patients. I know pharmacist Rahman has been joining me when I was at inpatient, and pharmacist Busayo Abolani has also worked with me, you know. Last year she was here, and now we have pharmacist Kemi Assis Shana, you know, also doing a residency in oncology pharmacy. So with that, there will always be somebody to take over. So I know there shouldn't be problem. Even somebody was here this morning again, that we like to do a research work in oncology. So with that, I know there will always be somebody to take over when we exit this office. So, and I have a pharmacist also, even working with me presently, pharmacist Raphael Ibiregbe. We were at Ibadan together to be trained for reconstitution of the chemotherapy, and we're at Lagos together for the upgrade oncology pharmacy. So there are a lot of people that are being carried along. Even pharmacist Kemi, I sent the link to her, and she was able to join the virtual training for the upgrade oncology pharmacy. So there are people that underground that are learning and learning. So, and I know as time goes on, there are people to really take over.
Yes, so she has a lot of people she's training.
Yes,
so she's not a one-man.
No.
A one-man show.
It's not a one-man show. I have people that I'm connecting with that are really going along with me.
Thank you so much. We appreciate you for the wonderful work you are doing, and I pray the Lord will continue to uphold you. I want to appreciate my Ogas, Pharmacist Shitu, Pharmacist Mrs. Elegbede, Pharmacist Adeleke, Pharmamin Camille, and Pharmacist Husseina. I appreciate everyone for joining us today. It's been very interactive, and I guess we've learned one or two things from this presentation in closing the care gap in cancer care. Pharmacist Musa Lawal, okay, welcome aboard. Your question, we have less than 2 seconds to go. Yes. Musa Lawal, kindly unmute yourself and ask your question. Hello, are you there? Okay, we'll close the care gap. Hello, Musa. All right, I guess it's error. Thank you so much. We would like to close this presentation for today. We hope to meet again in our next clinical meeting. It's been very interactive and educative. Thank you all. Our resource person has been wonderful. We appreciate you all. Thank you, Ma. Thank you, everyone.
Thank you for having me. Thank you.
Happy World Cancer Day. Bye-bye.
Bye.
Bye. Beautiful presentation. We are proud of you.
Thank you.
Thank you, Mom.
And old, rich and poor, black, white, and every color, male, female, trans, and other, the right and the left, east and west, followers, leaders, believers, and non, everyone. far more unites us than divides us. So let's all agree, the people and the powers that be, to make the world aware we need to close the gap in cancer care.